Right now, our region is experiencing the worst air quality in the world, and it's absolutely having an impact on people's health. The air is not just unhealthy, it's in the hazardous range. Everyone can have health effects from this smoke, and it's especially dangerous for our most vulnerable populations. First, I want to define the PM, or particulate matter. AQI, or air quality index, is based on many chemicals and particles found in the air. The current hazardous alert is now PM 2.5, which are particles of a size that are 2.5 microns or smaller. These are dangerous because they can get past our body's first lines of defense, such as nasal hair, and get deeper into the lungs than larger particles can. Those most at risk include people with underlying lung or heart disease. We know that air quality can worsen asthma or COPD, lead to increased heart attacks, irregular heart rhythms, and even death. The more vulnerable populations also include the elderly, generally 65 and older, pregnant women, and children. Elderly people and people with diabetes are more likely to have underlying cardiovascular disease that could be exacerbated by the poor air quality. Pregnant women's extra blood circulation and possible risk to the fetus are of concern. And children are particularly sensitive to smoke because their respiratory systems are still developing, their airways are smaller, and their breathing rate per their body size is greater than for adults. So the bottom line right now is please stay inside. Check on your friends, your family, and your neighbors who may be struggling. Listen and watch and get information at Oregon Air Quality Index or at airnow.gov. We do know that many, many people have had to evacuate their homes, and they may be staying with family, they may be staying in shelters, they may be staying in new places and exposing new people or being exposed by new people. The number one priority right now is safety and life. And we just ask that people continue to wear the cloth face coverings while you're indoors with people that you have not been exposed to before. If you're in new places and cannot maintain that 6-foot distance, keep those face coverings on because they do protect against COVID-19 spread. They may not protect against the particulate matter. There are certain masks that are specifically designed to filter out the PM 2.5, and that's really the N95 masks. However, to really protect from those need to be very well fitted. If there are leaks and cracks around, then you're going to pull in that air anyway. So we'd like for people to reserve those for our frontline workers, for our medical personnel. Only use the PM 2.5 masks if you need to be outdoors working for an extended period of time to help you protect from the air quality. Otherwise, please stay indoors. We do know that having underlying lung disease increases your risk of having adverse effects from COVID-19. We also know that having underlying heart disease increases your risk of adverse effects or bad outcomes if you get COVID-19. The ability for the immune system to fight the virus potentially could be impaired if you have increased particulate matter in your lungs. We really don't know enough about this virus to know how they're going to interact.